Hello and welcome to NHIS in a Week. We bring you highlights of events within the authority and the scheme. My name is Vaidai Duchimwa Boateng. Now, the headlines. Health Minister NHIS CEO speak on how to leverage scientific and academic research to achieve universal health coverage. NHIA organizes corporate registration for staff and management of Coca-Cola Company Limited. Ablekuma District holds its first stakeholder engagement. The Minister for Health, Honorable Kweku Agyeman-Manu, says leveraging scientific and academic research is key to achieving universal health coverage in Ghana. Speaking at a research symposium organized by Farm Access Foundation, the minister said there was the need to build sustainable partnerships between government, private sector, academia, non-state actors, and development partners to upscale service delivery and secure predictable health financing for long-term results on health outcomes.
The essence of the UHC roadmap is to localize the global UHC goals with adequate sets of national targets and milestones, and to guide the development of detailed strategies and operational plans to deliver health services to the people of Ghana. The Ministry of Health's UHC map is complemented by the revised National Health Policy 2020, which has 5 key policy objectives that border on universal health coverage. Policy Objective 1, to strengthen the healthcare delivery system to be resilient. And I think we are seriously on course getting that done, thanks to the epidemic, COVID.
The Chief Executive Officer of the National Health Insurance Authority, Dr. Okoboy, has noted that outcomes of the symposium will help the NHIA in formulating effective policies to expand its current coverage rate from 50% to 70%.
The NHIS has improved health-seeking behavior of a significant proportion of the population, evidenced by a substantial increase in membership and utilization of healthcare services, and has been recognized globally as a promising model for social protection in health. Our mainly tax-funded NHIS currently covers over 50% of the population and employs an inclusive benefits package estimated to cover over 90% of disease conditions reported in Ghana. Enrollment is mandatory by law, but the enforcement strategy has been graduated by demonstrating real value to members rather than trying to use coercive means. The NHIS currently uses 2 payment methods. We have the DRGs, that's the diagnosis-related groupings for services, and the fee-for-service for medicines. Ghana's UHC roadmap has 10 key strategies aimed at propelling the operationalization and implementation of key interventions to address the health needs of Ghanaians and accelerate towards the achievement of UHC. The NHIS is the first of these 10 strategies, making the NHIS indispensable to Ghana's UHC agenda.
Operations Manager for Farm Access Foundation, Dr. Gifty Sunkwa-Mills, believes effective implementation of research findings will go a long way to fast-track the attainment of the universal health coverage across the continent. Management and staff of the Coca-Cola Bottling Company Limited of Ghana have enrolled onto the National Health Insurance Scheme through the scheme's special corporate registration exercise. The special registration exercise is an initiative of the Corporate Affairs and the Membership and Regional Operations Directorates to register staff of various corporate organizations within Accra. The management of Coca-Cola Bottling Company Limited took advantage of the ongoing registration exercise to register their staff. Their staff registered, renewed their membership, and also linked their NHIS to the Ghana cards. The Ablekuma District Office of the National Health Insurance Authority, in collaboration with the Ablekuma North Municipal Assembly, organized a stakeholder engagement session for members of the Assembly and providers. The meeting, which was chaired by the presiding member, Honorable Edmond Lomo, was to task Assembly members, community committees, and providers to review and give recommendations to the strategy, which is aimed at identifying challenges of past efforts to drive NHIS membership in the districts. This week on Health Tip, we take a look at arthritis. This is how we wrap up this week's edition of NHIS in a Week. For details of these stories and more, do log on to our website www.nhis.gov.gh or follow us on all our social media platforms displayed on the screen. My name is Vida Educhimwa Boateng. Thanks for watching.